Lesson 6. First Aid. First aid. Accidents are unexpected and medical aid cannot reach the accident victim quickly. But some aid may be given to the patient to reduce the suffering before the doctor comes. At such times, the aid or treatment given to the accident victim is called first aid. It is very essential and saves the life of the injured person. There are three main aims of first aid: preserve life, prevent further injury, and promote recovery. First aid box. There should be a first aid box in every house, school, office, etc. At the time of emergency when you need to give first aid, then a first aid box is very important. A first aid box should contain scissors or blade, antiseptic cream, cotton, Dettol, Burnol, bandages. Some emergency cases and their home remedies are given below. Let us read about them. Cuts and wounds. A wound is caused by a cut on any part of the body. Wounds may either be superficial or deep. Wound, however minor, should not be neglected because the germs can enter our body through uncovered cuts, wounds or scratches. We should follow these steps in case of cuts and wounds. First of all, wash your hands. Never touch a wound with dirty hands. Clean all the wounds or bruises with sterilized cotton and apply an antiseptic cream or lotion on them. On the wound bleeding, place a hard pad of cotton and clean edge tightly. If a person falls on road or gets a wound with any iron object, then an anti-tetanus injection is a must. Fracture. While playing, jumping, falling, or by any accident, our bones may crack. This may result in a fracture. We should do these in case of fracture. Make the victim lie down, keep him calm and comfortable. To support the broken bone, tie a splint, which will prevent further dislocation of the broken bone. If the fracture is in the arm bone, use a sling made of a triangular piece of cloth. If the fracture is in the leg bone, make the victim lie down. Tie the splint around the affected part. Take the victim to the hospital on a stretcher. No more. A comminuted fracture is when the bone is broken into more than two pieces or crushed. Poisoning. All the poisonous things like naphthalene balls, nail polishes, paints, medicines, cosmetics and household chemicals should be kept away from the reach of the children. In case any child happens to take any of these things, give him lukewarm salty water to drink and try to induce vomiting. Rush the victim to a doctor immediately. Insect bite. In case of insect bite like bees, first try to remove the sting and apply lime water or ammonia to neutralize the bite. Then put ice cubes on the infected part and run cold water over it. Apply a paste of cold cream and baking soda. Snake bite. In case of snake bite, immediately give first aid because the poison of a snake moves very fast through the blood. It affects the heart and brain, causing death. Apply a tourniquet just above the bite to stop the flow of blood to heart. The tight band will help to slow down the spread of the poison. Cross the bitten side with a clean knife to about ½ centimeter deep and press that area to release the poisoned blood from that part of the body. Wash the wound with potassium permanganate. Take the victim to doctor as soon as possible. Drowning. If anybody is drowning in the water, bring him out of the water. Then follow the given steps. Make the victim to lie upside down with his stomach resting on the ground. Press his or her back to bring out excess water from his stomach. Then change the victim's position, that is, make him or her lie on his or her back. If the condition of the victim doesn't recover, take him to doctor immediately. Nose bleeding. Bleeding nose, especially in summers, can happen to a person anytime. Blood from the nose comes out when the walls of the blood vessels of the nose rupture. We should not panic at that time. We should follow these steps. Make the patient sit upright with his or her head held back. Press the bleeding side of the nose firmly. Apply an ice pack or a wet cloth to the nose of the patient. Ask him to breathe through the mouth and not blow the nose. Diarrhea. Diarrhea is a symptom of an intestinal disorder. When a person eats contaminated food or drinks polluted water, he falls sick. In such a case, the patient should be given a liquid diet. He should be given electrol or ORS, oral rehydration solution. ORS can be prepared at home also. Take a pinch of salt and a teaspoonful of sugar for 1 glass of water. Stir it well. It helps to replace the lost fluid from the patient's body. Drinking plenty of fluids helps in treating dehydration. Burns. Burns can be caused by fire, hot objects, chemicals, acids, etc. Burns can be minor or severe. The severity of a burn depends upon its size and the part which is burned. Burns can cause severe pain, infection, and unconsciousness. Minor burns are those in which only the outer layer of skin is burned. The skin becomes red with swelling and pain. In severe burns, the second layer of skin is also burnt. The skin reddens deeply. Blisters develop on the skin and the victim experiences severe pain. Blisters develop on the skin and the victim experiences severe pain and swelling. The blisters must never be pricked with a pin or any other sharp object. To give first aid to the victim, do the following. Put a lot of cool running water on the burn. You may also immerse the burn in cold water. The reddishness will reduce after this. Once it is done, apply an antiseptic lotion or a cream effective on burns. Cover the burn loosely with a clean bandage. No more. Henry Dunant, a Swiss national, founded the Red Cross in 1964. It was formed to render first aid to wounded soldiers. Today it is an international movement with hundreds of volunteer members, all engaged in running hospitals and clinics, collecting blood for patients and providing relief material for victims of floods, accidents, droughts, etc. Don't put cotton. Take a painkiller if the pain is unbearable. Never put ice directly on a burn. A wet compressed cloth dipped in a solution of baking soda can be applied on the burnt area. If blisters break, wash the area with a mild soap and water. After this, apply an ointment and a gauze bandage. Always cover the burnt area with a cool, moist bandage or cloth. In case of fire, if there is a fire in a building, inform the nearest fire station. If the fire is caused by kerosene or petrol, never throw water over it. This is because petrol, being lighter than water, floats on the water and keeps burning. Throw sand or mud in the fire instead. If someone's clothes catch fire, don't allow the person to run around. This fans the flames. Make the person roll on the ground. Wrap the person in a thick blanket which will put out the fire by cutting off the air supply. If the fire has been caused by defective wiring or an electric gadget, never throw water over it. Just switch off the main power supply.